54. Should I institute drug testing for all new hires?
Every supervisor knows that employees under any influence of alcohol or illegal drugs almost invariably produce inferior work, call in sick a lot, and threaten the safety of coworkers and customers. Fortunately, corporate America has clearly developed a consensus that the workplace is an appropriate site for confronting drug abuse. As a matter of fact, since the passage of the Drug-Free Workplace Act of 1988, there has been a nationwide decline in the use of drugs by employed individuals. That's the good news. The bad news is that workplace substance abuse still costs U.S. employers an estimated $120 billion each year. American Management Association's survey on workplace drug testing and drug abuse policies indicates that nearly 80% of surveyed companies have adopted programs to test employees for illegal drug use. Since 1987, the date of the AMA's initial survey, company drug testing has increased by more than 300%. According to U.S. Bureau of Labor Statistics, approximately 70% of large companies, 5,000 employees or more, have some kind of drug testing policy in place. The Drug-Free Workplace Act requires all federal government contractors and fund recipients to implement workplace drug abuse prevention programs. Such programs typically include a written policy, see Appendix G for a sample policy, supervisory training, employee education, an employee assistance program, EAP, resource, and drug testing. Prevention and deterrence are the key focus of most workplace programs. The Act doesn't include mandatory implementation of a drug testing program. However, companies governed by the Act may voluntarily employ a two-pronged approach to minimize drug use in the workplace. 1. A new hire testing program where applicants who test positive are denied employment. 2. An in-service program structured to get the substance-abusing employee into treatment and to provide the opportunity to get help, with the goal of getting the individual back to work. Tell me more. The Americans with Disabilities Act provides that a medical examination can be required only after an offer of employment has been made and before the beginning of the applicant's duties. However, a test to determine whether an applicant is illegally using drugs is not considered a medical examination. Therefore, if an employer wishes to conduct a drug test even before making a conditional offer of employment, he can. However, the ADA allows pre-offer tests only for illegal substances. Therefore, tests for blood alcohol level are permitted only after an offer has been made. In addition, the ADA protects applicants who have successfully completed a drug rehabilitation program. Therefore, an employer should establish a time frame within which an applicant who previously tested positive may reapply. Lab rates for pre-employment collection and testing range from $30 to $60 in many industrial clinics and medical facilities. Turnaround time for lab results is usually around 48 hours. The drug test screens for the following chemicals when urine specimens are collected: tetrahydrocannabinol, marijuana/THC. Amphetamines, uppers. A common side effect includes violent tendencies. Phencyclidine, PCP/angel dust, confusion, agitation, severe mood swings, and erratic and violent behavior are also common side effects. Cocaine metabolite. Barbiturates, sedatives. Benzodiazepines, tranquilizers. Morphine, codeine, methadone, opiates. Propoxyphene, painkillers. Alternatives to body fluid testing include hair analysis, papillary reaction testing, and video-based eye-hand coordination testing. Clear drug screen test reports will show none detected under each chemical area. By the way, it's a good idea to ask your provider to test for adulterants. For an additional fee of around $50 per screening, the clinic will check to see whether candidates have attempted to distort the results of the test by ingesting products meant to dilute drugs already present in the system. Some companies use on-site drug testing kits, rather than labs, for immediate results. The limitation to on-site kits lies in the fact that candidates have been known to sneak others' urine into testing rooms, thereby getting a clear report. Labs ensure against such deception by measuring the temperature of the specimen, locking toilet lids, and coloring toilet water blue, so that water can't be injected into the urine to dilute it. Remember that any on-site positive result should be sent on for a gas chromatography, mass spectrometry, GC/MS, confirmation assay in a certified laboratory to rule out a medical treatment or prescribed drug use. The legal issues surrounding workplace drug testing are numerous and complex. What's clear is that it's much more difficult to terminate a current employee who may be protected by the Americans with Disabilities Act and other rights of privacy than to terminate a job applicant in the pre-employment process.